hello everyone. Sorry, we lost you there. I think maybe Facebook tells us we're not allowed to go over 60 minutes. Maybe that's what we did. Where were we? So we were talking
about the volunteers thing.
Yeah.
Shall we start that conversation again? Because I don't know when it cut off. Actually.
Oh, it only just did.
Oh, okay.
I think just as I saw it go off as we were talking.
So you were saying about you agreed.
I really agree with you, and I also want people to be safe. So when if you are a volunteer or you're supporting someone else or other people in any way, I want you to be safe. And what do I mean by that? Know the limit that you can go to. So know when you feel comfortable with either supporting someone or listening to someone or offering advice. And I guess that's where you have to
There's
be
training,
yeah,
there's all that sort of stuff, listening and responding, there's all of those
absolutely.
Sort of calls. And also actually support for the volunteers themselves, i.e. what you do, what do they call that?
Which one's that?
So you go and speak to somebody every 6 months and sort of...
Oh, supervision.
Yeah, that's it.
It's every month, actually.
Is it?
Every month.
The rules are getting tighter. I'm not a rule man, as you know.
Oh, it's every 4 years.
Yeah. No, we did that. And I trained a group actually of volunteers, so I know. I was trying to think the word supervision. No. Yeah, supervision is that. So providing that, look, that's not hard to put in place, right? Is it? The professionals can put it into place. It's not hard to do. So what I'm saying is, for example, I went through transplant, right, bone marrow transplant, and I'm at one of the biggest teaching hospitals in London. They don't have a transplant group, right? It's a joke, isn't it? It's a joke, right? It's a joke. So
do they have one now?
No.
Oh.
I'm telling them to organise it, and I'll do it. But we're a year down the line, and they're still talking about it. So that's the sort of issues that you face, unfortunately.
Yeah.
And again, unfortunately, it's very hard for patients to do it on their own. They do need that sort of organisation. So, no, Margaret, in answer to your question, it's not only for professionals as such. There should be a lot more volunteer involvement.
Yeah.
And I think Margaret herself actually is doing some.
And support for those volunteers, right?
Yeah, exactly. They've got a proper group there.
Amazing.
Up in Leicester, they do their work. So. Sorry, I'm just going to keep an eye on that. There's something you wanted to come back to.
Oh, it was it antidepressants? So one of the myths around, whether or not. Well, actually, I suppose I guess we'll come to a close in the next 10 minutes.
Okay.
But something around what we do when we are worried about having a mental health issue, if or not we've been diagnosed with one, because we were talking about going to the doctor and being diagnosed with depression and having antidepressants. And I guess firstly there's how do we get over the stigma of a diagnosis or thinking we might be diagnosed, and secondly looking at the treatment options, because they're many and can be complicated to know what to do if we know that we need to get support.
Stigma is a massive one, actually. There we are, George. Thank you, George. Thank you for sharing, Chris. One of the big issues is that it still seems taboo to many to discuss this sort of thing. There we are. That's what you were saying there.
We don't really want to be honest about the fact that we've had all these fears and worries, and it keeps us from doing stuff, and it stops us from doing other stuff, do we?
No, exactly. You've just gone off on here, but I know you're up on there. So, you wanted to talk for the last little bit about antidepressants?
Well, just that idea of. Do you think we've covered stigma? Do you think?
No.
No.
I don't think we have. Actually.
That's a whole other hour. Stigma around. I imagine that what happens is we probably think that we should talk to someone differently if we think they've got a mental health issue. I can't bring my issue to them because they've got an issue already, so we perhaps avoid them a little bit more. In a let's say a typical case, we might worry that we would say the wrong thing if it was our friend. If it's us, we might feel that we have the wrong thing said to us quite a lot. Are you feeling better now? With mental well-being, mental health, is there a sort of point where you feel better? Not really. It's a gradual process.
It's a gradual process, yeah, absolutely. I mean, what about sort of, for example, at work, right? That for me, work for me is where I see so much discrimination.
Yeah.
Around cancer, right? So and that's quite a regular thing now. But I'm talking about, so if you go back to work and you're diagnosed with depression after you go back to work, can you imagine?
Yeah. You're standing by the water cooler, and for
Exactly.
people who have offices still,
Exactly.
and you're how are you feeling?
The lovely water cooler.
I'm not feeling great, actually. I've had a really bad weekend and I didn't sleep, and you know, what does how do you articulate that so it's true and honest, if you want to be true and honest, and B, how does somebody respond to that when they don't know the best way to respond?
I think we're reaching a time where we were with cancer, say maybe 10, 15 years ago, where cancer wasn't, first of all, it wasn't referred to as cancer, it was referred to as the big C.
Oh, God.
Okay, and it was sort of whispered around corners, and nobody talked about it openly, let alone make a video of it, right? I think we're going to be strung up by the secret police. So, I think we've reached that sort of position in terms of mental health, general, by the way, right? Yeah. But obviously there are so many strings to mental health. I'm only talking about the mental health side that reflects with cancer. Yeah. So the discrimination in the workplace thing, I'll go back to that. It's tough when you've got cancer, let's be honest. The rules and regs, we know about them, but actually they're not worth the paper they're written on in most cases. So when HR, they get the news that Chris is on antidepressants or Emily's on antidepressants, right? And you go back into the workplace and your pals begin to know that you're on antidepressants, right? Then what happens? Because no one's really sure, are they? They don't know through, it's not their fault. They don't know. Yeah. Fortunately, they haven't experienced it in most cases.
What if I ask you and you might cry? There's that whole idea of what do we do if somebody, I don't know how to cope with you if you cry, a lot of the work I do is about allowing those emotions out, and then maybe they're not always appropriate to cry everywhere, but it's so important to kind of try and feel what you feel, because if you don't, you're going to repress it all and it'll come out somehow. It's just later and usually bigger. So
how does the workplace cope with that?
I think there are probably some amazing workplaces that do get some of it.
I agree.
I'd love to see them. I'd love to come to your workplace and find out what that's like. Maybe they're smaller. I don't know. Maybe they've got really good policies in place about what this means when somebody goes through something. I guess also, Chris, we have to be honest and say cancer isn't the only thing that goes on in people's lives.
No, 100%. Listen, there's a lot of long-term illness. There's heart, diabetes, all that sort of stuff. Right, dementia is another one, right? Yeah. Long-term illness, which causes a lot of heartbreak around. So no, I mean when we're talking cancer for this conversation.
Yeah,
but it applies to a lot of other things.
So
absolutely.
Workplaces have to, I guess, go, all right, cancer is maybe one of 10 really serious things that happen. So how do we deal with all of them? So actually, this now applies to everyone, because it's how do you go back into a workplace with a big health issue that you're experiencing, and a mental health issue, and get that understood. And maybe it means that you have more time off work. Maybe it means you aren't able to travel into work as much. Maybe it means you have more appointments to go to, and getting over the stigma of that, of thinking people are going to think I'm lazy, people are going to think I'm not pulling my weight, people are going to stop asking me for projects, I won't get the promotions I want because they think I have a mental health issue, so they don't put too much pressure on me. Now, on the one hand, that's people trying to be nice, but on the other hand, it's actually discriminatory to not do something with somebody at work because they've got a mental health issue.
So can you see the issues that we're going to have, right? Let's be fair, there's not a good understanding. There's not even a good understanding about cancer, for example. So mental health is one of those areas that goes and you enter the grey zone. Right? Yeah. It may be this, it may be that, it could be this, it could do that. Nobody understands. We don't even understand it, right? And we're talking about it. So, to be fair, I can't moan about employers, because I think it's something that, as a society, we need to understand a whole lot better, and that's probably why we've done this, right?
Yeah, I hope so, because we can look back at this and say, actually, what might this conversation do for other employers? We can send it to some people and say, have you got a good policy? Have you got, I know that there are great workplace support organisations. Barbara Wilson's work with
Oh,
cancer,
yes.
you know, area is about working after cancer. So that is where all these resources can come together and say, what do you know? What's your expertise in this? Shall we have a look a little bit about sort of support and coping, you know, treatment with mental illness? We've talked a little bit about antidepressants. What do you think about treatment or support for people when when they've got a diagnosis or when they are thinking that they've got something wrong?
Support.
Yeah. What should support look like? What does support look like?
Support currently looks very sporadic, if I'm honest. As you said in your own example, there was only one psychologist in the hospital, and that pretty much looks the picture of the hospitals that I know. 1, 2, 3, you know, certainly not adequate for the numbers of people that I consider might need some help. It needs to be light touch anyway, that's for sure. Because a lot of people, it's hard, you know, a lot of people wouldn't accept that they had a mental illness. You know, for some reason, mental illness is treated very differently to a physical illness.
Yeah.
So it needs to be quite light touch, but it needs to be an issue that is around the minds of professionals that we see frequently, because we talked earlier that we may not recognise it ourselves, right? But these guys, you know, the health professionals to which we entrust our lives, they're seeing people day in and day out. They know what's normal for someone who's had long-term cancer, or it isn't.
Yeah.
You know, the holistic needs assessment, which we do, very good thing done by Macmillan, of course. A, not every hospital does it, by the way. B, some don't even have Wi-Fi for it. But the actual principle of it's good, because it means that someone, whoever that person is going to actually engage with the patient and find out more about their life.
I think there's also an issue around like what responsibility we have as an individual. Say if we recognise we have some issues, and that's really hard. Like we were talking about depression, the very symptom, the biggest symptom is sort of not wanting to, being able to do anything, because it feels when you have depression, you know, that severely that it won't make any difference anyway. So there's such a hard idea of this, you know, it's all very well, let's say, well, you can try meditation, you can try yoga, you can try changing your work, you could try sleeping better, you could try some medication too, you could try talking to a psychologist, you could try, I don't know, working with someone like me as a coach, let's say. But to be honest, when you're in that situation, you won't really take all of those pieces of advice or guidance or whatever, because you can't necessarily change very easily. So I guess it's that very fine line between knowing that you sort of need to do something, and that might just be a phone call to the right person, versus actually having something done to you and a team of people around you supporting you. And also that body and mind thing, right? So we can do things to our body that might help. We can do breathing techniques. We can I don't know, I do EFT, which is the lovely tapping. Completely alternative and random.
It's quite good actually, that tapping.
I love it. We've not talked about that, have we?
No, you do another session on tapping.
I love tapping. So brilliant. Actually,
it's good actually.
It's amazing, isn't it? Right, we'll do a session after. And you know, but so that's body stuff. You might do stretching. You might do exercise. Got great results for things like anxiety and depression. You know, clinically proven to actually improve the symptoms of depression. But also, you might need something for your mind. So that's where something like medication comes in, and not thinking so much about the stigma of medication, but knowing that maybe medication for that person is the right thing. It may not be the right thing for everybody, but it might be the right thing for that person. Getting the combination of body and mind support is really, I see, is really important.
I agree totally. I'm just watching the time now.
Yeah.
I think maybe
we're gonna
Facebook will cut us off.
Yeah, sorry Facebook.
Sorry, Facebook.
What would you like? What do you think your kind of summary point or resounding?
Yeah. Okay. I think the takeaway is you're not on your own. And I know I was deeply shocked that I was affected by it. I must be honest. because I see myself as, you know, the chirpy one, if you like. And I was quite shocked when someone sat me down and told me that all those things that were happening to me were because of that. And now I talk about it quite openly with people. I don't bring it up actually, but if people ask me about it, I talk about it.
Yeah.
And I don't have any. For me, there is no stigma to it. I don't have that issue, and I'll quite happily go and talk to people about depression. But I know it's a big issue. That is a big issue for most. And I'm saying that think about cancer as it was 20 years ago, and that's mental health now.
Yeah.
And the way that you're going to improve things is by talking to people,
Yeah.
and that's what's happened with cancer, and that's what will happen with mental illness. There should be no stigma. It's an illness like any other illness almost. You know, I'm not trying to compare, by the way, but it's an illness, okay? And for an illness, you need treatment.
Yeah.
And, you know, if you've got an illness, you'll need to go and see somebody about it. And you're probably the best person to know. If things are not normal, and if things have become, you know, you wake up in the morning and your head is filled with fog, that's probably the time to go and ask somebody about it. Or online. Look, there's a lot of online communities, right, Emily?
Yeah.
If you don't want to go to the GP and you think you might be wasting your time with the GP, get in touch with through my website, through Emily's website, and we'll be able to signpost you if we can't help necessarily. But we can signpost you to maybe somebody that will. So I think start thinking about it a bit more. I think is the answer to that. Be more aware of it, probably.
Take a look at what's been going on for you. What words do you say to yourself a lot, and have a word with yourself about what that means and whether that means that you're coping or not. It's all right to not cope. Use this as an opportunity to think about and then maybe reach out in some way, because that's where it's going to start to change a little bit. Just can't express enough how, you know, pleased I am to have spoken to Chris today about this. It's a really difficult subject. We could talk for hours. There's so many things about recognise it in ourselves. Just I hope that talking about it in some way, even if it's random and all over the place, is useful to just having it out there a bit.
Yeah, I think also I'd like to say to those listening, thank you for participating in it, because it's without you guys, it doesn't become as effective as it is. And also, if you'd like to share the video, which I know Emily's going to do, a lovely video she does. So I have to leave that part to her. She's very technical and very good on that sort of planning. Like
I don't know about that.
No, but you are. And we had a lot of hits on the last one, didn't we? And a lot of people learned a lot of things from that. So please do the same. Please feel free to share it in your social media channels or whatever.
And add comments, because this will be open and we'll read them and reply as well.
Definitely.
I hope you have a really nice day, everyone watching. I hope you have a very nice. Chris is going on holiday tomorrow. Exciting.
Yeah! I'm going to get battered by the grandkids.
Oh, my goodness. We've got a long weekend coming up in a few weeks, haven't we? So,
yes, I'll be back for that.
Yeah, we'll be back for that. We'll probably be back for another chat at some point.
I hope so, Emily. I hope so.
Good, yeah. Thanks, Chris, so much for your time.
Thank you. And thank you all out there in social media land.
Yeah, nice to see you. Thanks for your questions, and see you soon.
Bye.